is everybody claiming to have fungal acne these days? Hi guys, now this video is going to be a long one because we'll be talking extensively on two popular skincare issues: one, tinea versicolor, and two, fungal acne. On the subject of tinea versicolor, I would like to first make a distinction between eczema and tinea versicolor. Now this is what eczema typically looks like in skin of color. It is characterized by dark brownish, gray or ashy looking rash. Now eczema is typically used to describe like a family of skin issues that has to do with itchy, dry, scaly rash. Another name for eczema is dermatitis. Now for eczema, it could be atopic dermatitis, contact dermatitis, and seborrheic dermatitis. Now on the other hand, tinea versicolor looks like this. It is characterized by lighter patches that feel itchy. Now tinea versicolor is a fungi related issue. So basically what happens is there's an overgrowth of malassezia, which is like a regular yeast that stays on the skin. The reason you see these hypopigmented patches or these lighter patches is because when there's an overgrowth of malassezia, they secrete something called azelaic acid. Now if you remember, when you're treating hyperpigmentation, one of the things that you can be recommended is azelaic acid because it has tyrosinase inhibiting properties and can help lighten your skin. Now for eczema, on one hand, people that are prone to it are people that most of the time are genetically predisposed to it. That's why it's called atopic dermatitis. But for tinea versicolor, people that are at risk of it are people that sweat a lot, are in hot climate, etc. Now that we have known the difference between eczema and tinea versicolor, let's talk about fungal acne. Now although fungal acne is not exactly a type of acne, but let's just refer to it as fungal acne in this video. Now this is one of the skin issues that a lot of people misdiagnose. If you feel you have fungal acne, it is better you get professional help. If you go to a dermatologist, they could do something called skin scraping, do a biopsy on that to check that you actually do have fungal acne. For those that may not be able to go to a dermatologist, I could give you some pointers to be able to deduce that you do have fungal acne. And the reason this is important is some people misdiagnose pomade acne or closed comedones to be fungal acne. Now pomade acne is typically on your forehead also, and it happens when your hair product touches your skin and sort of clogs your pores. And then closed comedones, as we know, can be whiteheads, that sort of have like a raised bumpy feel on your forehead. Anyway, some pointers to checking if you have fungal acne is: one, you have tried a lot of acne treatments and there has not been any progress. Now I'm not saying you try acne treatment for just like a month or two. I'm talking extensive use of acne fighting ingredients, but you've not seen any changes. Another pointer is that they all look identical. The bumpy texture are quite uniform in appearance. Now it's typically on your forehead, on your back, on your chest, those kinds of areas. And lastly, it is very, very itchy. Now most of the time, people that have tinea versicolor also have fungal acne. People that are in hot, humid environments can also develop fungal acne. Now some people on antibiotics can also notice this. If you have an overactive sebaceous gland, you could also notice fungal acne because the yeast loves that oil. People that use steroids for extended period of time can also develop fungal acne. People that have dandruff or seborrheic dermatitis can also notice fungal acne. Now to treat tinea versicolor and fungal acne, because both issues are fungi related, the treatment is also quite related. Now topping the charts is 2% ketoconazole. It could be in shampoos, it could be in cream form, any of them is fine. Another ingredient that helps is selenium sulfide. It's typically in shampoos. You can use that to wash your face also. You could also use zinc pyrithium. You could find this in Head and Shoulders shampoos. It could also be prescribed oral antifungal medication. For skincare ingredients, salicylic acid can have some effect on fungal acne. Now for things to avoid, you want to avoid heavy creams, heavy sunscreens. You want to keep your skincare product as light and minimal as possible. Preferably use more gel-like products. So I hope this helps, and I'll see you on the next one.